Hi everybody, this video of mine is very important because this illness is very common and I have seen so many patients in my life, and with my clinical experience I am going to discuss how to manage this problem through effective measures. Okay, today's topic of mine is panic attacks and panic disorder. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. Panic attacks can be very frightening. When panic attacks occur, you might think you are losing control or having a heart attack or even dying. Many people have just one or two panic attacks in their lifetimes and the problem goes away, perhaps when a stressful situation ends. But if you have had recurrent unexpected panic attacks and spent long periods in constant fear of another attack, you may have a condition called panic disorder. This is very important to know the difference between panic attacks and panic disorder. Although panic attacks themselves are not life-threatening, they can be frightening and significantly affect your quality of life, but treatment can be very effective. Now let me tell you the symptoms. Panic attacks typically begin suddenly without any warning. They can strike at any time. Suppose when you are driving a car at the mall, or even if you are sleeping or in the middle of a business meeting. So this is a very important point to remember, that panic attacks can take place suddenly at any time without any triggering factor. You may have occasional panic attacks or they may occur frequently. Panic attacks have many variations, but symptoms usually peak within minutes. You may feel fatigued and worn out after a panic attack subsides. Panic attacks typically include some of the signs or symptoms which I am going to tell you now. Sense of impending doom or danger, fear of loss of control or death, rapid pounding heart rate, sweating, trembling or shaking, shortness of breath or tightness in your throat, chills, hot flashes, nausea, abdominal cramping, chest pain, headache, dizziness, lightheadedness or faintness, numbness or tingling sensation, feeling of unreality or detachment. One of the worst things about panic attacks is the intense fear that you will have another one. You may fear having panic attacks so much that you avoid certain situations where they may occur. If you have panic attack symptoms, you should seek medical help as soon as possible. Panic attacks, while intensely uncomfortable, are not dangerous, but panic attacks are hard to manage on your own and they may get worse without treatment. Panic attack symptoms can also resemble symptoms of other serious health problems such as a heart attack, so it is important to get evaluated by your primary care provider if you are not sure what is causing your symptoms. Now let me tell you the causes. It is not known what causes panic attacks or panic disorder, but these factors may play a role, which I am going to tell you now. Genetics. If you have a family history, there is a likely chance that you may suffer from panic attacks or panic disorder. Or if you are suffering from any major stress, or if you have a temperament that is more sensitive to stress or prone to negative emotions. Certain changes in the way parts of your brain function can also play an important role. Panic attacks may come on suddenly and without warning at first, but over time, they are usually triggered by certain situations. Some research suggests that your body's natural fight or flight response to danger is involved in panic attacks. For example, if a grizzly bear came after you, your body would react instinctively. Your heart rate and breathing would speed up as your body prepared for a life-threatening situation. Many of the same reactions occur in a panic attack, but it is unknown why a panic attack occurs when there is no obvious danger present. Now coming to the risk factors. Symptoms of panic disorder often start in the late teens or early adulthood and affect more women than men. Factors that may increase the risk of developing panic attacks or panic disorder include family history of panic attacks or panic disorder. Major life stress such as the death or serious illness of a loved one, a traumatic event such as sexual assault or a serious accident, major changes in your life such as a divorce or the addition of a baby, smoking or excessive caffeine intake, history of childhood physical or sexual abuse. Now let me tell you the complications. If left untreated, panic attacks and panic disorders can affect almost every area of your life. You may be so afraid of having more panic attacks that you live in a constant state of fear, ruining your quality of life. So this is a panic disorder. I mean, the difference between two is that panic attacks are the actual attacks, and panic disorder is when you live in a constant state of fear. That is known as panic disorder. Complications that panic attacks may cause or be linked to include development of specific phobias such as fear of driving or leaving your home, frequent medical care for health concerns and other medical conditions, avoidance of social situations, problems at work or school, depression, anxiety disorder and other psychiatric disorders, increased risk of suicide or suicidal thoughts, alcohol or other substance misuse, financial problems. So these are the complications. For some people, panic disorder may include agoraphobia, which is avoiding places or situations that cause you anxiety because you fear being unable to escape or get help if you have a panic attack. Or you may become reliant on others to be with you in order to leave your home. Now coming to the prevention. There is no sure way to prevent panic attacks or panic disorder. However, there are some recommendations which may help, which I am going to tell you now. You should get treatment for panic attacks as soon as possible to help stop them from getting worse or becoming more frequent. Also, you should stick with your treatment plan to help prevent relapses or worsening of panic attack symptoms. Get regular physical activity, which may play a role in protecting against anxiety. Now, coming to the diagnosis of panic attacks. When patients come to us, we determine if you have panic attacks, panic disorder or another condition such as heart or thyroid problem, because the symptoms of heart and thyroid problems resemble panic attacks. To help pinpoint a diagnosis, you may have a complete physical exam, blood test to check your thyroid and other possible conditions, and tests on your heart such as an ECG. A psychological evaluation to talk about your symptoms, fears or concern, stressful situation, relationship problems or situation you may be avoiding, and family history. So these things we ask during your mental health examination or once we take history. You may fill out a psychological self-assessment or questionnaire. You also may be asked about alcohol or other substance use. Now there is a criteria for diagnosis of panic disorder which I am going to tell you now. Not everyone who has panic attacks has panic disorder. For a diagnosis of panic disorder, the Diagnostic and Statistical Manual of Mental Health Disorder, that is DSM-5, published by American Psychiatric Association, lists these points which I am going to tell you. You have frequent unexpected panic attacks is the first point, or at least one of your attacks has been followed by 1 month or more of ongoing worry about having another attack. Continued fear of the consequences of an attack such as losing control, having a heart attack or going crazy, or significant changes in your behavior such as avoiding situations that you think may trigger a panic attack. So this is the second point for the diagnosis of panic disorder. The third point is your panic attacks are not caused by drugs or other substance use, a medical condition or another mental health condition such as social phobia or obsessive compulsive disorder. I mean, the panic attacks should be independent of these other mental disorders. If you have panic attacks but not a diagnosed panic disorder, you can still benefit from treatment. So this is very important point to remember. So I mean, even if your diagnosis of panic disorder is not so clear, you can still get great benefit of treatment. If panic attacks are not treated, they can get worse and develop into panic disorder or phobia. So these things you should keep in mind. Now coming to the treatment. Treatment can help reduce the intensity and frequency of your panic attacks and improve your function in daily life. The main treatment options are psychotherapy and medications. One or both types of treatment may be recommended depending on your preference, your history, the severity of your panic disorder, and whether you have access to therapists who have special training in treating panic disorders. Coming to the psychotherapy. This is also called talk therapy. It is considered an effective first choice treatment for panic attacks and panic disorder. Psychotherapy can help you understand panic attacks and panic disorder and learn how to cope with them. A form of psychotherapy called cognitive behavioral therapy can help you learn through your own experience that panic symptoms are not dangerous. Your therapist will help you gradually recreate the symptoms of a panic attack in a safe, repetitive manner. Once the physical sensation of panic no longer feels threatening, the attacks begin to resolve. Successful treatment can also help you overcome fears of situations that you have avoided because of panic attacks. Seeing results from treatment can take time and effort. You may start to see a panic attack symptom reduce within several weeks, and often symptoms decrease significantly or go away within several months. You may schedule occasional maintenance visits to help ensure that your panic attacks remain under control or to treat recurrences. Coming to the medications. Medication can help reduce symptoms associated with panic attacks as well as depression if that is an issue for you. Several types of medication have been shown to be effective in managing symptoms of panic attacks, which include selective serotonin reuptake inhibitors, that is SSRIs, generally safe with a low risk of serious side effects. SSRI antidepressants are typically recommended as the first choice of medications to treat panic attacks. SSRI approved by the Food and Drug Administration, that is FDA, for the treatment of panic disorder include fluoxetine, which comes with the name of Prozac, paroxetine, which comes with the trade name of Paxiva, and sertraline, which comes with the name of Zoloft. Second group of medication is serotonin and norepinephrine reuptake inhibitors, that is SNRIs. These medications are another class of antidepressants. The SNRI, venlafaxine, that comes with the name of Effexor XR, is FDA approved for the treatment of panic disorder. Third group is benzodiazepine. These sedatives are central nervous system depressants. Benzodiazepine approved by FDA for the treatment of panic disorder include alprazolam, that comes with the name of Xanax, and clonazepam, that comes with the name of Klonopin. Benzodiazepine are generally used only on a short-term basis because they can be habit-forming, or they may cause mental or physical dependence. These medications are not a good choice if you have had problems with alcohol or drug use. They can also interact with other drugs, causing dangerous side effects. If one medication does not work well for you, your doctor may recommend switching to another or combining certain medications to boost effectiveness. Keep in mind that it can take several weeks after first starting a medication to notice an improvement in symptoms. All medications have a risk of side effects, and some may not be recommended in certain situations such as pregnancy. Talk with your doctor about possible side effects and risks. Coming to the lifestyle and home remedies. While panic attacks and panic disorder benefit from professional treatment, these self-care steps, which I am going to tell you, can help you manage symptoms. First of all, you should stick to your treatment plan. Facing your fears can be difficult, but treatment can help you feel like you are not a hostage in your own home. Second is you can join a support group. Joining a group for people with panic attacks or anxiety disorders can connect you with others facing the same problems. Avoid caffeine, alcohol, smoking, and recreational drugs. All of these can trigger or worsen panic attacks. You should practice stress management and relaxation techniques. For example, yoga, deep breathing, and progressive muscle relaxation. Tensing one muscle at a time, and then completely releasing the tension until every muscle in the body is relaxed also may be helpful. On this channel of mine, Hobet Bibi, I have made another playlist which is music therapy. So these music therapy may also help you in so many disorders, especially mental health problems like panic disorders. So you can see so many relaxation videos, musical videos on this playlist of music therapy on my channel Hobet Bibi. Then comes that you should be physically active. Aerobic activity may have a calming effect on your mood. Also, you should get sufficient sleep. Get enough sleep so that you do not feel drowsy during the day. Coming to some alternative treatment, there are some dietary supplements which have been studied as a treatment for panic disorder, but more research is needed to understand the risks and benefits. Herbal products and dietary supplements are not monitored by Food and Drug Administration the same way medications are. You cannot always be certain of what you are getting and whether it is safe. So generally, we do not recommend these alternative medicine for this disorder. So before trying herbal remedies or dietary supplements, you must talk to your doctor. Some of these products can interfere with prescription medication or cause dangerous interactions, so you should keep in mind. I hope you like this video of mine. If you have panic disorder or if you are suffering from any other illness, please comment about your illness in the comment section of this video, and I'll try to reply to your comment as soon as possible. And if I get a time, I'll try to make a video on your illness. And till now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think my videos provide some sort of benefit, even if it is a little benefit, please like this video. That will give me encouragement to make more useful health related videos. And also please share these videos with your family and friends, and if possible share these videos through social media such as Twitter or Facebook.